Hi, in this video we will talk about mouthing behavior in children with autism, what it is, how it looks like, and what strategies to use in managing this behavior. Mouthing behavior refers to a repetitive action in which a child puts objects or body parts such as hands or fingers into their mouth. This behavior is often seen in children with ASD. Also, it is not exclusive to them and can be observed in typical developing children as well. Mouthing behavior can serve different purposes and may have various underlying reasons, including sensory seeking, self-stimulatory, exploratory, or as a mean of communication. In this video, I will present and refer to a diversity of strategies when the mouthing behavior is maintained by self-stimulatory reasons. While it can be challenging to manage this behavior, there are some scientifically recommended strategies that can help. It's important to note that every child is unique, so it may be necessary to experiment with different strategies to find what works best for a particular child. Here are some approaches that have been found to be helpful. First, provide appropriate oral sensory input. Offer safe and appropriate objects that can be chewed or sucked on, such as chewable toys, teething rings, or oral sensory tools. These items can fulfill the child's need for oral stimulation in a safe and appropriate manner. From my personal practice, I learned that every child is unique and one type of chewing does not work for all. Pay attention to the objects that the child attempts to mouth on. Is the surface smooth or rough? Is the child tempted to chew on fabrics? Based on your observation, you will decide what chewy to put in place for your child. Try to find the one that fits best for your child and satisfies his or her sensory needs. Second, create a safe environment. Make sure the child environment is well organized and provides appropriate sensory input. Some children engage in mouthing behavior as a way to seek sensory stimulation or to self-regulate. By providing a variety of sensory experiences through different textures, tastes, and smells, you can help satisfy their sensory needs. Third, use visual supports. Visual supports such as visual schedule and social stories can be effective in teaching appropriate behaviors and helping the child understand the expectations around mouthing objects. This visual support can also be used to introduce and reinforce alternative behaviors. For example, you can create a social story in which you use simple, clear words with real-life images that will describe individualized instances of the child's mouthing behavior and the socially appropriate, acceptable behavior to those instances. Fourth, reinforce alternative behaviors. Encourage and reinforce alternative behaviors that are more appropriate and fulfill the child's sensory needs. For example, if the child seeks oral sensory input, provide them with an appropriate chewable toy instead of inappropriate objects. Praise and reward the child when they use the alternative behaviors. Fifth and last, consult with professionals. It is important to work closely with professionals such as occupational therapists, speech-language pathologists, and behavioral analysts who have experience working with children with ASD. They can provide additional strategies and support to manage the mouthing behavior effectively based on individualized needs. While mouthing behavior is common in children with ASD, it is not always a cause for concern. However, if the behavior becomes excessive, poses a risk of injury, or significantly interferes with daily functioning, it is advisable to consult with a healthcare professional or a specialist in ASD for guidance and support. They can assess the specific circumstances and provide strategies to manage or redirect the behavior if necessary. I hope this video provided you with a clear understanding of what mouthing behavior is, what it looks like, and what strategies to use with it. If you have any questions, make sure you type them in the comments below, and I will do my best to get back to you. Thank you for watching. I'll see you in the next video.